In this lecture, we'll talk about some common diagnostic tests that, depending on your care area, you might see fairly often. So things like blood labs or radiology tests, etc. So here I have listed just some of the common blood tests. So we have a basic metabolic panel, a BMP. CBC is a complete blood count. Comprehensive metabolic panel is a CMP. B-type natriuretic peptide, BNP, cardiac enzymes, type and screen, beta HCG, fibrinogen D-dimer, INR PTT PT, thyroid function test, TSH T4, lactic acid, liver function test or hepatic function panel, and the hemoglobin A1C. So if you've ever had blood work done, I can almost guarantee you've had at least one or two of these tests done before. We'll go in and talk about a little bit about more specifically what some of these very common tests check for. So we have the CBC. So the major components of the CBC that we're generally paying attention to are the white blood cell count, hemoglobin, hematocrit, and platelet. So white blood cells are going to give us an indication of possible infection or immunocompromise. Hemoglobin and hematocrit will give us an indication of blood levels, if the patient is bleeding somewhere or having some issue creating those red blood cells. And then platelets is going to give us an idea of a patient's ability to clot. So this is something that a provider or a healthcare worker would look at to make sure it's okay to give an ordered blood thinner, an antiplatelet, so that we don't cause them to have less platelets because we want them to be able to clot if necessary. Then we have BMP, CMP, so basic metabolic panel and comprehensive metabolic panel. So the name changes depending on how many tests are being measured. So comprehensive will have a few more values reported than the basic metabolic panel does. All in all, it measures electrolytes, and important ones to keep an eye on are things like sodium, potassium, creatinine, blood urea nitrogen, and glucose. Sodium and potassium are really important electrolytes in the body when it comes to especially the function of the heart. Creatinine and BUN is going to give us an idea of kidney function, and that's going to give us an idea of a patient's ability to tolerate, fluids or certain medications. And then of course glucose is going to give us an indication of the patient's blood sugar. Is this patient diabetic? Are they having an acute infection that's causing their blood sugar to be higher, etc. So when I say cardiac enzymes, we're talking about two different tests that are usually grouped together. So we have troponin, which is a molecule that is fundamental to skeletal and cardiac muscle contraction. And then CKMB, or creatine kinase, enzyme found primarily in the heart muscle cells. If you have a higher than normal CKMB enzymes, it may mean that you have inflammation of the heart muscle, or you're having, or recently have had a heart attack. Same thing with troponin. If that troponin is higher, it's showing us that possibly there was some heart damage. So usually these are drawn serially, so not Cheerios, meaning they're drawn in incremental succession, so we can trend them to see if they're going up, if they're going down, etc. D-dimer. So blood clots are made up of an interconnected network of protein, the protein fibrin. When enzymes degrade this clot matrix, it breaks the clot into fragments containing 2 D fragments of the fibrin molecule. So D-dimer is generally something we order if we're suspicious of a large clot somewhere in the body, generally in the lungs, because we would expect that to be elevated. Then we have the hemoglobin A1C, aka glycosylated hemoglobin. So it reflects the average blood glucose over the past 3 months. So it'll kind of give us an indication of a person's blood sugar control. And you can see here by the images here on the right what denotes normal, pre-diabetic, and then an official diagnosis, or it helps confirm an official diagnosis of diabetes. So a couple more labs. International Normalized Ratio, or the INR, it measures extrinsic clotting pathway factors. It's affected by Coumadin use, liver damage, and vitamin K deficiencies. So it just gives us an idea of how thin the blood is. And then the sedimentation rate, erythrocyte sedimentation rate, or ESR, and CRP, C-reactive protein, known mostly by their shorthand SED rate, and CRP markers for systemic inflammation. So C-reactive protein, or CRP, is a protein made by the liver. CRP levels in the blood increase when there's a condition causing inflammation somewhere in the body. So it's not specific, it doesn't tell us exactly where inflammation is, it just tells us that it is happening. A CRP test measures the amount of CRP in the blood to detect inflammation due to acute conditions or to monitor the severity of disease in chronic conditions. Some other diagnostic tests, Hemoccult stool, or stool culture. So Hemoccult stool will determine the presence of blood in the stool. Sometimes this can be done as a bedside check. If we get fresh stool from the patient, it'll usually be done by a nurse or somebody that's properly trained, or we send it to the lab. And then stool cultures look for bacteria or parasites. And then urinalysis, pretty common, aka UA, can be used to determine rule in or rule out presence of UTI, kidney dysfunction, etc. Now let's move on to some common radiology studies. So we have things like ultrasound, Doppler ultrasound, CT scan, X-ray, MRI, and a HIDA scan. So an ultrasound uses high-frequency sound waves to see the body structures in real time. It does not use any radiation, and the waves don't travel well through adipose tissue or gas. So it travels better through fluid. So that's why if anybody's ever had an ultrasound to see their baby while they're pregnant, a lot of times they'll like you to have a full bladder, because they use that bladder as a window to the uterus, which is directly behind it. And then Doppler ultrasound, a special type of ultrasound that allows blood flow to be seen. It's used to diagnose things like deep vein thrombosis, so blood clots, and testicular ovarian torsions. So these would be commonly used, these would usually be used in a specialty setting or somewhere like the ER. So a CT scan combines a series of X-ray views taken from many different angles to produce cross-sectional images of bones and soft tissues. It does have high levels of radiation, and there's limitations in patients who have renal failure because they cannot have contrast dye CT scans. So not all CT scans are with contrast, but many of them are. So that would be limited in patients with renal failure. X-ray is probably the most common first-line imaging, probably something we've all had done at least once. Uses electromagnetic radiation to look at the body. It doesn't allow soft tissues or organs to be visualized well. So this is mostly to rule in or rule out a bone abnormality. It doesn't really show us if there's, tendon, ligament, or muscle issue. MRI, so these use a magnetic field and radio waves to create detailed images of organs and tissues within the body. There's a huge cost with these images. It takes a lot of time, and often it's not readily available in a variety of clinical settings. So this is not something you're going to see in an urgent care or in a primary care office. Sometimes there are freestanding MRI places, but generally this is going to be in a hospital. And even in a hospital, there's probably only one. And MRIs can take upwards to 1 to 3 hours depending on the area being assessed. HIDA scan, so hepatobiliary immunodiacetic acid scan. So used to diagnose problems with the liver, gallbladder, and bile ducts. So usually used to evaluate right upper quadrant pain if the patient has a negative CT scan and gallbladder etiology is suspected. So this is also called a cholecystography. Scintigraphy. It's I'm butchering the name. Hepatobiliary scintigraphy. It's an imaging test used to view the liver, gallbladder, bile ducts, and small intestines, and the scan involves injecting a radioactive tracer into the person's vein. The tracer travels through the bloodstream and into the body parts listed above. So it'll help us determine, is there a blockage somewhere, is there decreased flow somewhere, and maybe that would help indicate where the issue is. So just like anything else, in your position as a medical scribe, it's not necessarily your job to be super familiar with exactly how each lab test works, what it's checking for, how each radiology test works, or what it's checking for. It's more for your information. It'll help you be better at your job to have a basic idea of what all of these things are checking for. However, it's more your job to make sure you're pulling up relevant studies for your physician to readily compare them to current studies. Additionally, it's important for you to stay on top of the tempo, especially if you're working somewhere like an ER. The expectation is that those labs come back within a certain amount of time so that we can keep patient care moving forward. So that is also part of your job. And just in general, the more you know, this information will be valid in future career paths, career shifts, and endeavors. Each care area will have its own list of commonly used lab tests, radiology tests. You might be able to predict what your physician's going to order based on how well you know them and how long you've been working with them, but it's just helpful to have a basic knowledge of all of these things. And any questions, comments, or concerns, feel free to let me know.